When is care not care? It's when costly medical interventions are used in patient care with no evidence of specific benefits for the situation at hand.
If you get a test, maybe an expensive test or an invasive test that might have risks associated with it, but the reason you went into the doctor in the first place really doesn't suggest the need for that test, then to me that's not care. It looks like care, it feels like it certainly costs like it, but in the end, you're not likely to benefit from that, so the best term I can come up with for that sort of situation is not care.
How much not care is actually going on? Most healthcare economists estimate between 20 and 30% of U.S. healthcare expenditures are for interventions that have not been shown to benefit patients, costing $2.2 trillion a year. Kelsey-Seybold Clinic is among many well-known medical group practices in the United States, including the Mayo Clinic, Kaiser Permanente, and Scott & White, that support the concept of evidence-based medicine. For example, if there's no evidence that the colonoscopy, cardiac catheterization, nuclear medicine treadmill, or spinal fusion surgery performed is likely to benefit a particular patient, then the patient has experienced not care.
And a lot of things we've traditionally done over the years turn out to maybe not be that valuable. So Kelsey-Seybold, as a group practice, we emphasize to our doctors that, try to do what's right for the patient, try to have some evidence or expert opinion behind you when you recommend something. And if there really is no good evidence or expert opinion that suggests that doing a test or a procedure or a therapy is likely to benefit that patient, then don't do it.
Here's an example of not care. In scenario number 1, a 45-year-old man experiences back pain after swinging a golf club and has pain radiating down his right leg. His physician suspects a herniated disc and recommends an MRI of the spine, even though there are no red flag or critical symptoms that might indicate the need for urgent intervention. The MRI shows a bulging disc, which is typical in 50% of all cases with or without critical symptoms. The physician prescribes rest and medication, with advice to follow up if the symptoms do not resolve. The pain is resolved after 1 week. The MRI of the spine costs $600 to $800. Now, scenario number 2 with the same patient. He experiences pain down his leg and has no red flag or critical symptoms. In the absence of red flag symptoms, the physician advises rest and medication, with an MRI to be taken only if the patient fails to respond to this course of treatment. The pain is resolved after 1 week. The MRI is not needed after all, and so the cost and risk of unneeded testing is avoided.
Most people, even with a ruptured disc or sciatica, they get better on their own. We treat them conservatively. After a week or two, pain's totally gone. They go on about their lives. There's no need for intervention like surgery or injections or anything like that. In that case, if you followed the guidelines, you normally would not need an MRI. If you ordered the MRI and the patient progressed as you expected, they got better, you really didn't have any value to that patient. You have a pretty picture, which is very nice, but it didn't really help the patient's care.
Commonly overutilized high-cost procedures include colonoscopies, esophagus and stomach scoping procedures, heart catheterizations, nuclear medicine cardiac stress tests, MRIs for back pain, and spinal surgery. How does Kelsey-Seybold deliver evidence-based medicine? With an established physician culture that supports the practice of evidence-based medicine through the adoption of accepted expert clinical guidelines, through a strong departmental structure enabling effective ongoing education, collaboration, communication, and ongoing review and intrinsic monitoring of medical care, through Kelsey-Seybold's ability to support early adoption of appropriate new technologies and practices, through investment in electronic medical records, which maximizes the availability of patient information to multiple treating physicians, thus avoiding duplication and unneeded retesting.
If a test or a procedure is not really indicated, if there's no evidence behind it, then what you're doing is you're spending money for no benefit to the patient, and in many cases you're spending money for something that might very well make the patient worse. By avoiding that, by just simply trying to do what's right for the patient, not trying to do a bunch of extra stuff that has no evidence behind it, we believe, and data does show, we've shown it many times, that our quality of care is higher than what would be expected normally, and our total cost of care is significantly lower. So in my mind, it really is a win-win situation for our patients.
As a high-value, evidence-based and multi-specialty medical group focused on medicine and quality care, Kelsey-Seybold provides comprehensive and personalized care to patients, leading to higher patient satisfaction and lower total medical costs.